So today we'll be talking about ocular pharmacology, the various routes of drug administration, as well as the list of drugs that are used in ophthalmology. There are different ways by which a medication can be instilled in the eye. It can either be a topical medication, it can be periocular, where drug is injected around the eye, intraocular, where the drug is injected inside the eye, and systemic systemic drugs, which can have effects in the eye. So first, we'll talk about the topical medications. Topical route of administration includes the following. You have the eye drops, the eye ointments, the gels, and occlusives. So topical also you have different modes of instillation. Periocular injections can be subconjunctival into the subconjunctival space. Subtenons can be retrobulbar or peribulbar. These are all different spaces where the periocular injections can be given. Intraocular can be either intracameral. Intracameral means injecting a drug into the anterior chamber, and intravitreal, which is injecting a drug into the vitreous cavity. Lastly, have systemic. It can be either oral, intramuscular, or intravenous. So these are different routes of drug administration. So eye drops are the most common mode of drug administration in ophthalmology. The normal volume of conjunctival sac is around 7 to 10 microliters. So we instill one drop inside the eye because the conjunctival sac has a capacity to just take one drop. If you put more, the excess drops just go out. So what are the measures to increase the drop absorption or drug absorption? We need to wait for 5 to 10 minutes between the drops. So because if you put more than one drop within that space, it is just going to go out and it's going to go a waste. So we need to give a space of at least 5 minutes between two drops. Compression of the lacrimal sac, which reduces the amount of systemic absorption of the drug, so it provides more drug to the eye. Keep the eyelids closed for 5 minutes after instillation also helps in increasing the drug absorption. Ointments, they increase the contact time of ocular medication to the ocular surface, thus they have a better effect. But they are not available for immediate use. They take some time for the actions to start, so it cannot be used for immediate use. It has a disadvantage of vision blurring. Yes, that is one of the major problems with ointments. That is why most of the ointments which we prescribe are meant for nighttime instillation. Gels have got prolonged contact time and they do not cause much blurring of vision, but they have the disadvantage of being pretty expensive. Ocucerts are also called as sustained release devices. Here, the drug is delivered through a membrane, which is placed in the upper or lower fornix, and drug is released from it at a constant rate. So there are a few ocucerts that we use in ophthalmology. We have the pilocarpine ocucerts in glaucoma to decrease the intraocular pressure, and we also have a ganciclovir sustained release device, which is used as an ocucert. Periocular injections here, the drug reaches behind the iris lens diaphragm, and it is said to have a better absorption when compared to topical application. The various routes under this are the subconjunctival, the subtenons, peribulbar, and retrobulbar. They bypass the conjunctival and corneal epithelium, so they have better absorption when compared to topical medications. Steroids and local anesthetics are given by this route, especially the local anesthetics, the peribulbar and retrobulbar block. They're usually given just prior to performing any intraocular surgery. intraocular injections, either intracameral into the anterior chamber or intravitreal into the vitreous cavity. Under that, the examples are intracameral adrenaline, which is mainly given to maintain the pupillary dilatation or to dilate the constricted pupil during cataract surgery. Intravitreal antibiotics are given in case of endophthalmitis. Intravitreal steroids are given for macular edema, and intravitreal anti-VEGF agents, that is vascular endothelial growth factor, which is given for diabetic retinopathy. So these are different intracameral and intraocular injections which are given. Last route of administration is systemic, which can either be oral, intramuscular, or intravenous. Intraocular penetration again depends upon the blood aqueous barrier. The drugs with low molecular weight and high lipid solubility are said to cross the blood aqueous barrier a lot easily, and thereby they have a better effect